feelings, and it's okay to feel those feelings, but it's time to put some more, I would say, put a little bit more pressure in us taking care of ourselves and trying to get out of this funk. So the objectives that we're going to learn today is how to manage your mental health during this difficult time, therapy and telehealth, and how to keep yourself calm for yourself and your family. So there's a lot of ways that our mental health is affected. I could write a whole PowerPoint on how we've been affected by this, but some of the things that came up just in, searching social media, talking to people, is that the worry and fear surrounding COVID-19 has increased anxiety, panic attacks, and depression throughout the country. So symptoms that maybe people haven't experienced often, whether it's restlessness, not sleeping, having thoughts of sadness, not eating, severe anxiety to the point where their heart's beating really fast. They feel like they're having a stroke or it's turning into a panic attack. This has all increased within the last couple of weeks. Excessive anxiety that leads towards depression and hopelessness. So when we're anxious all the time, it feels like nothing's going to get better. And so when things feel like they're not going to get better, that's where our mind does put us in a slump of not wanting to get out of bed, not wanting to eat, not wanting to socialize, kind of putting all of our duties that we normally do to the side. And when we do start getting those symptoms, it starts turning into really negative thoughts. Nothing's going to get better. We're all going to get sick. I'm going to get COVID-19. I'm not going to make it. Why even push through? And those are very, very dangerous things to think, because it turns into suicide ideation. And so even though everybody has anxiety and worry, which is not a problem, because I think everybody has experienced anxiety in their life, that's not the problem. The problem is that if we're not addressing the anxiety, if we're not putting some context to the anxiety or proving our anxiety wrong, it's going to put us in the rabbit hole of a lot of severe mental health issues. Mental health symptoms can also cause physical health issues such as headaches, rapid heart beating, stomach ulcers, cold, flu-like symptoms. If your body is malfunctioning due to anxiety and stress, your stress can lead you to believe you're sick when it's stress-induced symptoms. I am a person where the stress doesn't live in my brain, it lives in my body. So I can go 9,000 and think I'm doing just fine, but I'll start getting a cough or I'll start getting body aches. It seems like I'm coming down with a cold. But literally, if I just take a couple of days off and sleep and just relax, I start to feel better. And so I want everybody to be mindful that at some point your mental can't take the capacity of the stress. So it's going to attack your body. And if it attacks your body, your anxiety is going to get worse, because now you're going to think that you're catching COVID-19 or the flu or having something else going on. So you really have to take our mental health into a consideration of priority during this time. Some other dynamics that we're considering is having the entire family at home can be overwhelming, and having to work and continue family roles. So let's be honest, a lot of us are not ready to be teachers or babysitters. And so having all of your kids at home, whether they're young to almost graduating high school, it has been a lot. And if you are in a partnership, a marriage, a relationship, and both of you are ordered to stay at home to work, or you've gotten laid off, that's another added pressure, because we're not used to hanging out with each other all the time. We're used to doing our own thing during the day, or we have different shifts. And so when we're just looking at each other, it can cause a lot of tension in the household. On top of that, if you have those dynamics going on, you're not able to work properly. So you have your family and your work. You don't have any type of outlet going on. And so you're just going nuts. Not being able to see your partners often can increase loneliness and depression. A lot of people are in long distance relationships. They can't see each other, or maybe their partner is a vulnerable part of the vulnerable population. It's best if they just keep their distance. And so the connections that people were having in person, is no longer existing right now. And so it has really played a role on people's mental health. Not knowing if you're going to be laid off or fearful you may be exposed to COVID-19, increased mental and physical health complications. So a lot of us are on the front line. We're an essential worker. I do believe that mental health professionals, if there's any on the line, you are a medical worker, and I appreciate your service. And whether you're doing telehealth or you're actually going into the office and providing services, I commend you. And the ones that are not essential workers and they're working, but they don't know how long they're going to be working for, a lot of this has suddenly just fell onto our laps and we don't know how to process. But all of this stress of not knowing what's going to happen, the fear of the unknown, am I going to work? Am I going to get laid off? Is my job putting me at risk? Am I going to get sick? All of these things can cause you to be sick. And lastly, I just want to remind everybody's mental health is being challenged during this time. My mental health is being challenged. Politicians, medical people, everybody experiencing some type of anxiety, depression, mood change, hopelessness. And so we're in this together. So if we're in this together and we get the information and the tools that we need, then we can spread it to others and get through this difficult time, because it's not a forever thing. It's just a temporary thing that we got to get through. So this is not a presentation necessarily about all the symptoms and signs of anxiety and depression and suicide and all that, but I did want to bring to the forefront, as a therapist that is heavily into minority mental health, and I'm also known as a Black men's therapist, I thought it was very important that we acknowledge what depression can look like and suicide, because before the pandemic happened, some of us were already experiencing these symptoms, not knowing what they're called. And so if we didn't know what they were before and they've gotten worse now, I want to put a name to the symptoms. And so I'm just going to leave this up very briefly. These are infographics. If you guys have been to past webinars or follow me on social media, you have seen these all over the place. These are 6 signs of depression in Black men. It's not an extensive list or this is all the symptoms, but these are the most common, as well as some facts about Black men and suicide, because they do have the highest amounts of completed suicides in the Black community. And so if you or someone you know, and this can still, like I said, this can apply to other communities, it can apply to women as well. If you are seeing yourself experiencing these symptoms and it is causing yourself to not function at the capacity that you used to before all of this went down, or even before this went down, you've noticed that you've been having these issues, you may be experiencing depression and severe hopelessness. Also, we want to keep in mind about our adolescents and our women. So once again, I made these last year. These are 6 signs of anxiety in Black women. Of course, there's always more symptoms that could be added. These are the most common, as well as adolescents. And so we got to be mindful as well that our adolescents definitely are struggling. A lot of them liked going to school. A lot of them complained about going to school, but they liked being there because they were able to hang out with their friends. They had some sense of independency when they were away from their parents. Some of them are, moving on to next grade or graduating, and with every state changing when they're going back to school, some may be going back to school, some may not, but a lot of proms, a lot of senior trips, a lot of field trips, a lot of events have been canceled. And so the things that our youth are looking forward to are no longer, around. And so they are struggling extremely, especially if they do come from households that maybe don't have as much. And so getting that lunch or that breakfast was really important for them. And so trying to get food now or just trying to stay busy has been a challenge. Lastly, a lot of them may not be doing well learning online. Some of them need to be in person in the classroom, raising their hand, the camaraderie of, their classmates, and they're not able to have that. So we do need to keep in mind that our adolescents are going through it too. So the big question I always get when I do webinars is, how do I know if I need therapy? So I say for everybody needs therapy, even if you're doing, so in life, nothing traumatic is going on. It's always good to go to therapy just to continue to work on your coping skills, talk about things that are happening in your life, and just keeping, the most clear, healthiest mental health that you can, because things may come up, and when those things come up, you'll be able to identify what's going on and how to manage it through therapy. However, in this scenario, There's a lot of, like we talked about, anxiety, depression, mood changes going on. And so if the worry and anxiety is becoming unmanageable, you're sleeping the day away to speed up time. You're thinking like, well, if I sleep all day, then this will go by faster. I don't have to do life. Sleeping less because you're worried about the virus in the country. You literally are up at night looking at conspiracy videos, Googling all the symptoms, Googling all the stories of death, not looking up who is surviving, but focusing on who's passing away from it, or going on social media and watching everybody's comments and concerns about it. Your anxiety and your worry is taking over your life, and it's causing you not to sleep. Sleep is very important when it comes to our mental health and physical health. So if you're not sleeping, you're really shutting down your entire body. You're developing panic attacks, or your body's going through changes that feel like illness. Panic attacks can come out of nowhere. Sometimes it's due to a situation. Sometimes they just come up. And so when you have a panic attack, you may get hot. You may start having rapid heartbeats. You may feel like you can't breathe. It feels like you're having a stroke or a heart attack. So if you feel like you see an increase of those, or you're starting to develop them and you didn't have them before, you may need to get into a therapist's office to see how we can reduce those panic attacks and get you some coping skills. Also, if you feel like you're sick all the time, if you know that you haven't been exposed, which, once again, I'm not a medical professional, so I know that you may be walking around thinking that you're okay, you may have symptoms, but if you're noticing because you're worried all the time that you're feeling sick, it may be due to the fact that your anxiety is fully taking over your body. If you're having thoughts of suicide, if you feel like things are not going to get better, you don't know if this world is going to make it past this pandemic, and you just don't know if you want to be a part of it, then you absolutely need to get to a therapist. If you can't get to a therapist, I need you to call a hotline. I need you to call a friend. I need you to call somebody, because these thoughts are so overwhelming that we're forgetting that it is a temporary situation, and that there is a very good possibility that everybody's going to get through this, and we're going to move forward. If you're stuck in these thoughts where you feel like it's going to be a forever thing, you're going to make decisions that you cannot reverse. Suicide is permanent, and most people that want to die by suicide is because they want to get rid of the pain. It's not really because they want to end their life. And so if you're having these thoughts, even if they're mild, please reach out to someone and talk to them. Processing what's happening is difficult, or your symptoms are affecting relationships around you. If you're not able to identify how you feel, but yet you're walking around like a zombie, you're not really forming words, you are not really talking to your family is concerned about you. You may not understand in a moment what's going on, but there's something that's bothering you, and it's time to address it. And so sometimes our family or ourselves can't get us on that track, but a therapist can. At the end of the day, whether this slide applies to you or not, if you have more time on your plate to take care of yourself, everybody should get in therapy. This is the time where we can really work on ourselves, get our coping skills, get all of our emotions under control, so that when it is time to start progressing back into society and get back to the normal routine, you are well equipped to keep going. So everybody should go to therapy. Now that we talk about therapy, with everything that's going on with the social distancing and all that, it's very imperative that we keep distance from each other, and so we need to practice telehealth. And so telehealth is the use of various technology to provide health services. It can be used for medical or behavioral health. So some medical doctors, I'm sure, maybe you guys have experienced it thus far if you've already tried to reach out to your primary physician for any advice or issues, that they're doing it by video or they're doing it by phone. So not only do therapists use telehealth, but so do medical doctors and psychiatrists as well. It's accessible through phone and or computers, through video conferencing platforms such as Zoom. So the platform that we're on right now, Doxy.me, which a lot of therapists are using, etc. You also have My True Circle, that's a good one. Excuse me. And if you are a therapist or a medical professional with a private practice, your electronic health record may offer telehealth capabilities as well. It can also be used through messengers such as text messages or other messaging platforms. So some therapists do text their clients, or there are platforms that do offer text services because everybody may not be able to do phone calls or video chats. Of course, there's always that confidentiality piece, but with everything that is happening right now, the number one concern is just to get everybody the support that they need. So text messaging or using a messenger platform that is encrypted is an option as well. So the pros and cons of telehealth: the pros, it's accessible anywhere, home, office, car, wherever you can fit in. You can log on and talk to your therapist. Flexibility in scheduling. So a lot of times therapists or individuals have a specific time they like to be in the office just for safety reasons and things like that. But a lot of therapists will span their schedule if you're able to do telehealth. So for example, for me, my practice, Empire Counseling and Consultation, I live in California, but a lot of my other locations are in other states in different time zones. And so I provide sessions up until midnight Eastern Standard Time. And so that's helpful for people that don't work their traditional schedules, or they're at home and they have to take care of their kids and they just can't run to an office really quick, so they can put the kids to bed and log on the computer and get their one-on-one time with me. So there is a lot of flexibility in telehealth. The comfort of your own space. Man, how many times have I heard that some people are terrified of coming to a therapist's office? They don't know who's looking at them. They don't want to have, they're scared of that stigma, or people are going to know that something's wrong with them, which, by the way, because you go to therapy does not mean you have a severe mental illness or a mental illness in general. It just means you need support and coping skills to continue life in the most healthiest way possible. So some people don't like to be outside the home, or they don't like to go to offices, and so you're able to have therapy in your own room, and that's comfortable for them. It can be covered by insurance. A lot of insurance providers have waived co-pays. They have added telehealth to a lot of plans so that everybody can get their needs met. So if you do have insurance, you can check with your therapist if you already have one, if your benefits will cover telehealth, or if you're interested in getting into therapy, reach out to your insurance and can let you know what your options are. And lastly, the accessibility to more mental health providers. In every webinar that I talk in or speaking engagement, I always talk about the need for minority therapists. And so a lot of times people will try to find like a Black therapist and there's none in like a 20-mile radius. Well, how telehealth works is as long as you're licensed in that state, you can service anybody through telehealth. And so you may find that specialist, you may find that Black or brown therapist that you're looking for through telehealth. So with telehealth, you can have access to more providers than you would in your area. Now, of course, when there's pros, there's always cons. So the cons of telehealth is finding privacy or places to have your session. That's why a lot of people are struggling with telehealth, because they're like, my kids, my husband, my girlfriend, everybody and their mom and the dog is at home, and I have no privacy, and I don't want them to know my business. So they don't want to get online. They want to go to the office because that's their me time. Less personal connection with the therapist. A lot of people connect with the in-person face-to-face, and so talking through a screen or a phone, it feels a little less impersonal, and they're not able to be as vulnerable or connect with their therapist on that level, so they feel like it's not beneficial for them. Failures of technology. Especially with everybody being home right now, I've noticed that my internet has gotten slower, especially when I'm scrolling through social media or I'm trying to work on my dissertation. So there are times where the connection may go out, or it's staticky, or it freezes. And so that can be very disruptive if you're pouring your guts out to somebody and all of a sudden their face freezes and you don't know what happened. Symptoms are too severe for method of treatment. So everybody is not a candidate of telehealth, depending on the severity of your disorder. Sometimes psychotic disorders or mood disorders are best suited to be treated in the office, or if there's severe suicide ideation. But in terms of what's happening right now, this may be the best method. And so whether you're experiencing mild symptoms or severe symptoms, you still need to reach out to a therapist and address the issues. So please, if you have a therapist, do not ghost your therapist. In the current state of our nation, telehealth is the best option to maintain social distancing and keeping everyone healthy without compromising your mental health. I know that everybody says, well, it's only going to be a couple of weeks. I'll wait. I'll just wait to see what happens. At the end of the day, there is no end date, and I put that as one of the bullet points. Our mental health can't wait until this is over because there's no end date at this time. I know that we've been hearing conversations about, oh, we want to be back by Easter, we'll be back by April 6th, but at the end of the day, when we really look at what's going on, because the numbers are increasing of people being diagnosed with COVID-19, there is no end date. And so you're literally putting your mental health on the back burner, and all the work that you're doing with your therapist, it's unbinding, it's becoming undone. And so when you finally get back in, not only are you going to have to address the things that have occurred during this time, but you're going to have to go back and address those things that you already have before. And so it's very important to just comply with telehealth in the meantime. It's safe for us to get back into the office. Lastly, if we don't have to put ourselves in jeopardy, we shouldn't. And so while I know it's important for you to see your therapist face to face and have that contact, you're also putting your therapist at risk. And so if your therapist is at risk, all of her clients are at risk of not being able to get services. He or she's there, hers or his clients cannot receive services. So it's important that we just keep everybody's health in mind. States that have called for a state of emergency has lifted laws surrounding mental health providers having to be licensed in that state to allow any licensed mental health professionals to provide services in their state. So being said that some of the states, and at this time, I have seen literature, but you're always welcome to look it up. Alabama, Delaware, Virginia, and DC, I believe Colorado has a stipulation that because they're in a state of emergency and their residents need help, if you are a licensed provider in your state, then you are able to provide telehealth services to those states that I mentioned without being licensed in their state. Of course, when the state of emergency is lifted, then you will have to refer them to a provider in that state unless you're licensed. And so that's another opportunity if you are a licensed professional, if you want to help, to go across those state lines being ethical, because that's the number one thing we always want to be mindful of, is being ethical, is number one, check the state laws, and also be mindful that you can't provide services in other states during this time. Many insurances have waived co-pays and are covering telehealth sessions, as I talked about before. A lot of insurance plans, such as Blue Cross, Aetna, they have released statements that they are waiving co-pays until further notice. And so if that's been a burden for you that you can't fork out any additional money because you need to keep it for your family or your essential needs such as food, shelter, whatever the case may be, talk to your insurance and they may be able to waive your copay. And once again, our mental health can't wait until this is over because there's no end date at this time. So let's talk about some tips for staying calm. Please, please, please limit the amount of news updates you watch or see on the internet. Limit to 45 minutes per day and break it up. So please do not watch 30 minutes of the news or 45 minutes of the news at a time. I say watch in 15-minute increments, and so 45 minutes gives you like a morning, afternoon, evening. But the key is do not watch it right when you get up. Do not watch it right before you go to bed. Have your breakfast, take a shower, do some yoga, twerk, whatever you need to get ready for the day, and then introduce it into your day. So pick a news station that has like a ticket paper where it gives you current news that's happening and while I talked about COVID-19, and then shut it off. And then later on, because at the end of the day, everybody is just trying to be the outlet that has incoming news, but it's not necessarily new news. It's actually causing more panic. So if you limited how much you watch news, you're going to see that's going to improve your mental health tremendously. Modify your social media and unfollow news or blog pages that update heavily about COVID-19. Instead of following them, Just go to their page when you want to look at them. One thing that we're in control of is our feed, is all of our social media feeds. And so if you find that certain pages are always updating, or people are always reposting news stories or commentary about how people are feeling, mute them, unfollow them, and when you want to see what's going on their page, you can type in yourself. You'll have control of how much content you'll see. On Twitter, on Facebook, I'm not sure if it's on Instagram, I don't think it is, but there's a mute option where there's certain phrases and words and people you can just mute for 30 days or whatever the case may be. So if those words come up in any of the posts, you won't be able to see it. Some words that are sensitive to people is COVID-19, death, illness, President Trump, you name it. So figure out what those words are for you and mute them. Keep a normal routine. This is key. I think probably for the first few days of quarantine, until everybody felt like when we get out of school for spring break, we stay up, we eat all these snacks, and we have no care in the world. And then around like day 5, we're like, yo, this is kind of crazy, and I don't feel very good about this. I need some structure. I need to get back to my routine. That is what's going to be key in keeping your mental and physical health together, is keeping your routine. So regardless if you're working from home or you have nothing to do, get dressed at your normal time. So take a shower when you normally do your hair, get dressed, make up your bed. That's the key. Once you kind of make up your bed, you feel like you can't get back in the bed because you don't want to mess up your bed. So if you keep that routine, it's going to help you, stay on track. Eat breakfast if you eat breakfast. Create a workstation outside your bedroom. Please do not make your bedroom your chill zone, your study zone, your work zone, your arguing zone. Your bedroom is supposed to be like your sanity, your place of relaxation. And so if you are working from home, pick another area in the house to work instead of your bedroom. Take breaks from working at home. Let your eyes rest. Blink. Rubbing your eyes is not always the best thing, but blink. Look away from something else. Close your eyes for a minute. Take 15, 20-minute breaks as you would normally do at work. Take a walk around the house. Take a walk outside really quickly. Do some jumping jacks, whatever you can, to just get that blood flowing somewhere else and to take your mind off of work for a little bit. And go to bed at a decent time. One thing that's difficult is if you're staying up to 3 or 4 scrolling social media, watching Netflix, and then you're sleeping till 1 in the afternoon, you really have no structure in your day, and there's no motivation to get structure in your day. So make sure you go to bed so that you have a night's rest and you're able to function throughout the next day. Incorporate more hobbies. This is the time to get back to your first love, whether it's cooking, painting, coloring. There's adult coloring books. If you can't find one, I mean, of course, right now, a lot of places are only shipping essential items. So printing out like coloring sheets from the internet's helpful. Knitting, exercising, watching webinars for development. There's a lot of things that you can do that's personal development, that's self-care, that you can do without having to be somewhere trying to find an activity. You can do it from the comfort of your own home. Get some fresh air. Social distancing doesn't mean staying indoors 24/7. So a lot of people feel like if they have to stay inside the house, they can't leave the house unless it's for the grocery store. You can go in your backyard and get some air. You can open up a window. You can open up all the windows in your house and just let that fresh air come into your house. A lot of times we just need some air for us to breathe and just get, a second wind of what's ever happening in the day. So please incorporate getting outside, even if it's just to the mailbox, to the driveway, or if you have a local park. I know most parks, I think all parks in California, all of like the playground equipment, the benches and all that is taped off, so you can't, of course, go there. But the outside areas, such like grass areas, are still open. So if you want to take a quick few laps around, walking or jogging, or stretching, please get some air. Meditation is always good. There's plenty of apps out there that will teach you how to meditate, guided imagery, guided meditation. That's free. If you know that you can't meditate because you get off track, there's apps that will help you get back on track. Attend virtual meetups or clubs. There's been so many Zoom meetups with friends, different people that are getting people together, or even on Instagram Live, a lot of DJs been having a lot of amazing music sets. Get into all of that. I mean, even though we can't have like the physical touch of people, just knowing that somebody is there, whether it's on the screen or on the phone, it does bring some comfort. And so please, please, please get involved in all of those. It's all free. Create activities to do with the family, whether it's cooking with the family, watching TV with the family, exercising, making Play-Doh, making slime, coloring, having conversations, playing Monopoly, whatever it is. Create more activities where you guys can do it together. So we're increasing the conversations and the desire to have more connection with people. You can do that with your family at home. Make lists. A lot of times our anxiety, we feel like we're unorganized and it's chaos and we have no control of our life. Make a to-do list of things that you need to get accomplished. Make a goals list. What are things that you would like to accomplish in the next 3 to 6 months or the next 1 to 5 years? This is a time to just write out all your hopes, dreams, and ambitions and make it happen. An organization list. If you need to clean out your closets, if you need to do spring cleaning, if you need to clean out your car or, restock or reorganize things, this is the time to make those lists so that you can be more in control of your day and things that you need to get accomplished so that when you get it done, you can be proud of yourself. Connect with old friends and family through phone or video chat. This is the time that if you haven't talked to Aunt Sally in 6 months, hit up Aunt Sally and see what's going on, or old friends that you haven't seen since high school or since the last girls' trip. This is the time where we can connect with people and just have open conversations about what's happening in life and just getting that emotional connection that we need as humans with one another. Lastly, do a virtual date night with your partner or home date once a week. If you can't see your partner all the time, there's nothing wrong with both of you guys maybe ordering to go food from the same restaurant, sitting together and eating it on a video chat, or if you're living together or able to be around each other, still having a date night, whether it's Netflix, doing an activity such as cooking or painting, or anything. You still need to have date night. We still need to keep the passion and the connection going. So I encourage everybody that is in a relationship to date virtually, safely, or if you're living with that person, have a date night at home. So I want to give some adolescent talking points really quick. So talking to your adolescent, because they are going through their own mental health issues, please make sure that you are there for them if they want to talk. Remind them that they're not in this alone. Ask permission if you can share a story about a time when you were in high school and something happened before just putting it on them. Because sometimes they just want you to listen. They're not looking for your feedback or opinions. That you'll just listen, you won't say anything, reminding them that you love them and are there to help if they need you to. And also just tell them, like, I noticed something's been different with you. Is everything okay? Please avoid asking what you have to be depressed and anxious about, because they got a lot of things they can be depressed and anxious about. Making statements such as middle and high school is easy, wait till you become an adult. It's not easy for them right now. And you can remember a time when you were in school that school was challenging and life was challenging at that time too. So we need to practice more empathy. I won't put more on you than you can handle. When somebody is going through an emotional time, the last thing they want to hear about is they have to be strong. They're talking about it because they're looking for some comfort. Or I can give you something to be sad or depressed about. A lot of times parents say that in sarcasm. Some of them really mean it. It's just not appropriate. It's not helpful for the adolescent, and they're not going to talk to you or tell you anything anymore if these are the things that you're telling them. So lastly, here are some important reminders. The concerns and fears surrounding COVID-19 will be around for some time, so do not put your mental health treatment on pause. Even when the country is back open for business per se, there's still going to be a hesitation about, is everything going to be okay? And so it's going to take us a while to bounce back from this. So please, in the meantime, go to therapy, use your coping skills, talk about it, process it. Please do not put it on hold till it's time to go back to work or go back to reality, as we would say. Social distancing does not mean you can never go outside. Taking a walk around the block or around the park is not harmful. Doing it in groups or being around others is a no-no. So please do not go on your walks with others in groups, because that's the whole point of us quarantine or isolating at home. But if you just need to get 5 minutes of fresh air, there's nothing wrong with it. If you have if you're driving to the store or you're going to get takeout, if you have a sunroof, open up the sunroof and just let the fresh air. I'm telling you, fresh air is key to releasing a lot of tension in your body and your mind. The more you use your coping skills, the more manageable the chaos is. It doesn't go away. We just need to know how to deal. So none of the chaos is going to go away. It may subside, but it's always going to be there. And so as long as we're able to manage it, that's the most important part. We're not getting rid of it. There's no end date to the madness. We have to take it one day at a time. And lastly, be kind to yourself. You're a human being, and it's okay to be worried and concerned. Process and manage is key. So I will give you access to my website, but on my website, I do give free downloads just to help people outside of COVID-19, just things that are going on in life. And so if you're finding yourself being overly stressed, anxious, and depressed, and you know it's something, but you're not sure really what's going on, or not remembering how you're able to calm yourself down, this downloadable worksheet, which is free to everybody, will give you the tools to understand where is it coming from and what are some things that you can do to manage the symptoms. This worksheet has been downloaded over 500 times, and everybody has said it's been very helpful for when they can't get to their therapist, or they're in process of getting to their therapist, or they're just not able to get to therapy at the time. At least this is something that they can do to better understand their symptoms. Also, I do have a worksheet called 100 Low Budget Self-Care Tips, where I give you 100 ways to do self-care without having to spend pretty much any money. A lot of things that are on this list you already have, or you were born with it. So that's also available as a resource for you guys. Some other resources that you can look into: therapyforblackgirls.com, therapyforblackmen.com, melaninandmentalhealth.com, mytruecircle.com, psychologytoday.com, the insurance database, and OpenPath are all databases where you can find therapists. When it comes to Psychology Today, I don't think that you can use a filter to specify if you want a minority therapist or not. You would just have to scroll through the website. But all of them have filters as far as what insurance you need your provider to carry, what specialties you're looking for, gender, and location. And so if you're looking for a therapist or need to find a new therapist, these are the platforms that you can go on to search. Therapy for Black Girls also doubles as a podcast, so it has a lot of great topics that discuss mental health, relationship issues, and gives you the coping skills that you need. I am on session 49 for angry Black women if you're interested in listening. Also, to mention, OpenPath.com is a database where you can find therapists that offer sliding scale, which is a lower fee service. I believe all the services are less than $60. I think they're between $30 and $60. And so if insurance is not an option for you, if paying over $100 is not an option for you, check out OpenPath to see if you can find a provider. My True Circle is an online database for telehealth providers. It was developed by a Black man named Lenny. He's a mental health advocate and serves on a lot of nonprofit boards and is super tech savvy. And so he has partnered with Zoom for his platform to provide not only telehealth for therapists to provide on his platform, but also he has a database of therapists that provide telehealth. And if you are a therapist that's looking for a telehealth platform, I highly recommend My True Circle. I have yet to have any complications with the service since using it in this pandemic as well as before. And lastly, SAMHSA is always a good resource if you're in the medical field, if you're in the behavioral health field, if you're just somebody that wants to learn more about COVID-19 and some of the tools and things that you can learn for yourself or for your clientele or for your clinics. Please visit SAMHSA. So if you want to contact me, I'm on all social media platforms. I'm on Instagram at the Patrice Nicole. Facebook and Twitter, Patrice and Douglas, and my websites are patriceanddouglas.com. That is where you can find all my downloads for free. And if you're looking to book a session, you can follow or find me on empirecounseling.net. And so now we are ready for questions. I am going to put the resource list back up for you guys just in case you weren't able to catch it.
Thank you, Patrice. So you all can type your questions in and I will read them anonymously. In the meantime, a few have come across. Would you speak a little bit to seniors, with this being a time when many seniors are quarantined or isolated away from their friends and family, loved ones? Can you speak a little bit about some tools for seniors?
Yes. So with seniors, I know that they may have limited resources. And so my recommendation for seniors is to always have a phone check-in with a family member or a loved one or a friend where you're talking to someone daily. If you are able to use social media apps or whatever, using grocery pickup apps such as Instacart or Shipt, where you can get some resources as far as getting your groceries delivered to you so you don't have to go into the stores. I also encourage for seniors, if you are able to journal. A lot of seniors are feeling isolated at home. They don't want to bother their family. If you're not comfortable with calling your family all the time, journaling is another option that's best for you. And lastly, I would say for seniors, if you're scared, please reach out to someone, whether it's a hotline or someone that you trust. This is something that is scary for everyone, and you are not a burden to anyone. And so constant communication with someone is going to be key to get you through this pandemic.
Okay. Are there any resources for LGBTQ youth of color? This is a very vulnerable population during this time.
That is a great question. So I am not aware of this time if there's specific material resources for the LGBT youth of color at this time. I do know that a lot of the resources that I provide for adolescents does help with that population. But if you would like to provide contact information to Melissa, I can further research and see if I can find something and send it to you.
For parents with children at home, they're saying basically have children of various ages. What are some of the things you recommend that parents can do with children to be able to keep some normalcy and calmness in the home?
I think mimicking their school schedule. So if they get up at a certain time to eat breakfast, go to school, I would keep that same routine. So having them make up their bed, having them eat breakfast, having them take a shower, get dressed. If they have to work on school for a little bit online, have them do that. Maybe break with a snack. Developing more activities such as like making Play-Doh. Play-Doh is so much fun. It's literally, I think, 4 ingredients of water, cream of tartar, flour, salt, 5 ingredients, sorry, and I use Kool-Aid because it smells really good. Making slime, having open conversations, or even making like a movie like Inside Out where you can have dialogue. I think just having more of the routine happening as if they were going to school and encompassing it with different things that you can do at home together as a family is really going to help the kid, because if they're just at home looking at you working or looking at you, you know, being around the house, and then they're at school virtually and there's no other structure going on, they will lose interest in school and everything that's going on around them. So just engaging in more activities and trying to keep the same time schedule as if they were going to school is going to be key.
Thank you for the presentation. What is the best way to deal with the pace that your employment is moving in decision making in light of the pandemic?
Ooh, that's a good question. So I think it just depends on what the job is. There are individuals that feel like their job is not taking their safety in consideration, or they're not keeping them updated as much as they should be, or they're just not feeling comfortable about what's going on. So at the end of the day, our jobs are very important, but also is our state of mind and our health. And so if you have questions or you're not comfortable with something, it's okay to bother your management or continue to ask questions. And if at any given time you feel like it's not the right fit for you, then it's time to decide if you can continue working in the capacity that you are. But I think at the end of the day, what we have to be mindful of, and this is something that my staff is mindful of, is that things change every day. And so there's that human compassion piece, that even though we have individuals that are in charge of us and are supposed to take leadership and handle certain things, they're getting information told to them as much as you are, and sometimes that's not enough. So also taking that human piece of like, I need to be patient with my coworkers or my management, because things are changing every day and we're just all trying to get through this together. I hope that that was helpful for you. If not, you can always reach out to me and I can give you, more specific information.
What is your suggestion to support incarcerated persons with low offenses being released in light of the pandemic? More often than not, this is negatively impacting communities of color.
Oh my gosh, whoever asked that question, that just feeds my soul. As a clinic director, I work heavily with the federal probation population, and so that's always my concern is when they come out of being out of incarceration and having to adjust to their new normal. The best thing that I would say for that answer is to be mindful that there's a shift that's happening. And so even though on the outside they seem to be okay, they're still processing what's happening, because no matter if you were in jail for 20 years or 3 days, it's going to change you regardless. Being behind a cell and with the diseases roaming around and everybody talking about it, there's already a fear there. And so when they're coming out, there's already a sense of anxiety that's already probably being diagnosed, or PTSD. And so when it comes to the incarcerated population, it's more of don't have any expectations set on them. Just have open communication and be supportive as much as you can. So instead of assuming that, oh, well, you're back out, so you need to go work or you need to go do this and go do that, have conversations of like, how are you feeling? What would you like to do today? What can I do to help? Just try not to put that expectation on them. I wish I could have a whole PowerPoint on that, but that is a very, very good question.
How should you, I guess they're asking, how do you recommend people interact with their pets during this time?
Well, pets can sense everything, right? They're our emotional support animals. So I think, the normal routine of playing with them, spending time with them is normal. If you're over petting them and they seem like they want to get away from you, because that does happen. My dog is very moody, and when she doesn't want to be around you, she's going to go upstairs and let you know if she needs some space. So sometimes your pet may need space, but I think that as long as you show them love and affection, you allow them to sit with you when you're watching TV, and you pet them in the normal routine that you normally do, you should be fine with your pet, because they sense everything. So they know that something's going on. But please engage with your pets, because they're going to be key in making you feel better as well.
To provide teletherapy, does the therapist have to be an independent therapist?
So I'm wondering if you're saying they have to be a licensed therapist?
Not for sure. So the person that typed that question, if you could send me or Patrice a separate, she's saying yes. So
so yes, telehealth. Okay, well, let me back up. So there's a lot of states, right? So every state has their own guidelines, but for the most part, is if they are a registered therapist, and when I say registered, that means they're an intern, so they're gaining their hours. They can be called an intern, they can be called an associate, they can be called a provisionally licensed therapist. They're named for everything. If they are being supervised by a supervisor, on certain circumstances, if they're like cash-based therapists, they can provide telehealth. But if it's insurance that's accepting or providing the telehealth, so you're getting telehealth through your insurance, they do have to be a licensed therapist. And so all therapists have to be in some form or fashion registered or licensed to provide telehealth. And depending on the circumstances, they may have to be licensed. I hope that answered your question on that. But yes, you should always check to make sure that your therapist is registered with the board of any state that you're in. And I think I saw something about the state lines about therapy. So like I said, every state has their own regulations about therapists. Everybody should be licensed in that state. There are a few states at this time, like I said, I believe it's Alabama, DC, Virginia, Delaware, and possibly Colorado, where because they're in a state of emergency, that they are allowing at this time, if you are licensed in your home state, you can provide telehealth to their residents. But that is a very temporary order, and once the state of emergency is lifted, you have to stop seeing them for services unless you're going to get licensed in that state. So I think I saw that question somewhere. I hope that answered that.
There was a question. I have a friend in Long Island, New York. She has recently become homeless and seems overwhelmed and is speaking hopelessly. And they're asking, is there any help for her in New York? And so is there, Patrice, I'll ask you to speak to maybe some tools or things that the person can do for them. I have the person's name, so then I can, after the webinar, share some resources and work directly with them. If there's anyone on the webinar that has any recommendations, you can also send that as well.
Yes, so unfortunately, my home state is not New York, so I don't know the actual resources for the state of New York. But I would say that I know that there's a national database that everybody can use, and that is 211. And so if you're looking for shelters or temporary housing resources, I would say that that would be the best bet. If there is any way that you can help her find shelter, as far as if she can stay with someone, I think that'll be more helpful. One thing about the hopeless piece is that if you don't have shelter where you can feel comfortable and safe, that is going to turn your anxiety and your depression to the highest level of no return. And so if she can find any type of stability of living somewhere where she feels safe and comfortable, that's going to be helping her with the hopelessness piece. Like I said, as far as New York goes, I don't know any resources specifically because that's not my home state, but I do know that 211 is still operating, and they usually do have the most up-to-date resources in the state.
And Melissa, this is Virginia, because we have to close at this point, but we do have some resources here in New York that we can post and perhaps respond to the last question. Okay, I think we're at the point where we do have to close, but I just want us to thank Patrice for a wealth of information and the tips for staying calm during this public health crisis and beyond. Let's do much of what she said, especially taking one day at a time, being kind to yourself, your family, and your friends. And I would add, let's also celebrate special occasions and activities. And while I'm certain there are many on the call today who are celebrating birthdays, but we know that Lisa Matthews is celebrating a birthday, and we want to wish her happy birthday and many, many more to come. So thank you for joining us. And again, we wish the very best for everyone, your loved ones, your families, to stay healthy physically, emotionally, mentally, and spiritually. And stay tuned to the virtual presentations that we will be making. And you can receive this information on our website, as well as we will be sending out through our Comcast list. Thank you so much, Patrice, for this presentation, and we thank everyone who participated. Have a blessed day. Thank you.
I want to let everyone know that we will make available on our website and our social media information about today's webinar. Each of you will also receive an individual email from us that will include the recording along with some other tools that Patrice has made available to you all. Thank you very much, Patrice.
Thank you for everyone for joining me. Once again, you have my contact information. If you have any additional questions, I'll be more than happy to answer them.